$500,000 a year of bills. And let's say your bill review, this is $500,000 of bills with 1,000 bills, which would be an average of $500 a bill. Okay? Your bill review claims 50% reductions, which seems great. You only pay $250,000 on that $500,000. Well, 1% more savings is $5,000. So obviously 2%, 3%, you just multiply it from that. So what are these bill review programs discussing? Fee schedule. They're talking about saving you $1 per bill for these 500 bills. Now, when you do the math on that, $1 per bill over 500 bills is a $500 saving. Just 1% savings is $5,000. And we often see savings of 10 and 15% in these programs, which basically makes this per line fee negligible. If you're looking at overall cost as an employer, because this is what you're paying and what you're directly saving. This isn't the vested interest of somebody's program that's just making money on the front end of it. So the solution's simple. Do a test run. Talk to other people that have done test runs to actually see who some of these employers are using to save money in bill review. Pharmacy programs, I'm starting with this one because it kind of follows and falls into bill review. It's something that not everybody has, that I can't believe not everybody has, because they need it. And the reason they need it is the amount of savings in pharmacy, the amount of abuse in pharmacy is enough to justify setting up an EDI feed, which is done through bill review, for an EDI feed to be in tangent with bill review and with pharmacy. You're not paying any more. You're basically taking that bill and sending it through to capture savings on the pharmacy end as well as the bill review end. So why do employers not know this? Why is this something that is not discussed with them from a TPA end? Well, there's no money in it, and it's more training and work, not necessarily work, but more understanding. It's another service that the adjusters oftentimes aren't familiar with. It's not very complex. It's basically bill tracking in a system. You know, to understand the way that a pharmacy program works is, if you take, you know, the internet and you link it to all the pharmacies across the country, or almost all of them, what, 90-some%, this is a real-time company that is monitoring your claimants and their pharmacy use. So now, anything that happens out of the ordinary, whether it's an early refill, a duplicate prescription, duplicate doctor, whatever, or a medication that shouldn't be authorized to the particular injury, the adjuster is going to receive an email or a phone call from the pharmacy. There's a real-time control that's happening. And this is, of course, the soft savings of a program, meaning it's catching things before they happen. It's not taking them and retroactively discounting them. So the soft savings portion of the pharmacy programs is more money right now in California than the hard savings. The hard savings used to be a ton. Now that fee schedule's been dropped and everything has been lowered, it's much less. However, there's a trick to it. You can still negotiate costs with your pharmacy providers. And this is really the third type savings I'd like to talk about. Let me make sure I covered everything with pharmacy. So basically, the two types of savings of pharmacy, hard and soft savings, they both need to be captured. The soft savings, obviously, I've seen numbers upwards of 30% on all pharmacy bills when it's totaled up on just soft savings. Hard savings used to be easily that much. Now it's much, much less. However, if you pre-negotiate a pricing contract, which can be done, and this is something that you should be doing possibly with transportation, with DME companies. We talked some earlier about having more control over your program. These costs can be set up in advance. They're not fee schedule costs often. However, you can, and if they are fee schedule, you set them up so it's 5% below or 10% below or whatever you can negotiate with your provider. So for pharmacy, there's your hard savings. You're negotiating a 5% fee schedule discount. Additional 5%. What's that worth to you? It's easy to get. It is. Field case management. This is number 4, and I do want to bring it up because it's another example of what happens when there's too little control. Usually these services cost around $100 an hour. What's happening right now is adjusters are making decisions for the employer based on who needs field case management. Again, the average case on these can be $1,000-$2,000. It can be a significant decision. There is a time and a place where a nurse is needed. So the hard savings on this really would be managing the utilization so that you're taking over when this is used and when it's not. It's hard to justify the actual hard savings impact on a claim. You do want to work with a company that can document this. Most companies can, but it is important. The soft savings, obviously you've seen the savings reports that the nurses are documenting what they're doing, but as an employer, you're driving clear guidelines about when field case management is utilized and when it's not. This is not made at the adjuster level. This is dictated by you, given to the carrier, so the carrier is now following what you want based on how conservative or liberal you want to be with this type of service. So it's more than just a savings, it's more getting back again to your decision and what kind of program you want to run, how aggressive you want to be with getting your claimants back to work, and what kind of investment you want to make. Last program, and I bring this one up as number 5 because I have seen it more and more lately popping up in carriers throughout the state, and that is on-site telephonic case management programs. Again, specifically on-site TCMs now that are either revenue shared or hired by the company, the carrier, as a nurse working for them to manage claims telephonically. So, in saying this, I know several excellent nurses that do this on site. This is not a knock on a nurse, because if you really look at it across the state, when it comes to nursing, there's going to be different levels of nursing within every company and independence. That's not the driving factor in this. What it is just like the doctor referring to PT. Telephonic case management is another way for carriers to bill employers on claims, possibly, and work, possibly, that the adjuster should be doing. These numbers are getting higher and higher. As a TCM on-site stays more and more, oftentimes another one will come in, more and more claims are coming in, and more things are being done at the TCM level. Really, and this is an important part of the program, I believe every program should have a TCM, a telephonic nurse of some kind, either on or off-site, really helping the adjusters, helping the employer in managing these claims medically. At the same time, this is something that needs to be looked at to make sure that it is not being overutilized, because the costs run up fast. So, interview your TCM, and those are the 5 things that I wanted to go over. Thanks again for listening. If you have any questions, my information is at the end. Again, my name is Goss. Have a good one.